Hi, I'm Dr. Donna-Marie Manasseh. I am a board-certified breast surgeon practicing at Maimonides Medical Center in Brooklyn, New York. Interestingly, I think my medical training started in my high school. I actually am an alumni of Brooklyn Tech High School. I then went to Cornell for undergrad, where I specialized in biology and society, again looking at not just the science of medicine, but also the other things that happen to medicine, ethics, anything that had to do with the physical space that a person was involved, legal issues with medicine. Transitioning then to Harvard Medical School, and then ultimately did a fellowship at Memorial Sloan Kettering in breast cancer surgery. My specialty is breast surgical oncology. I chose that field probably because when a woman gets diagnosed, thankfully most times it's on a mammogram or they may feel something on their exam. And for the most part, they otherwise feel fine. They don't feel any pain, they don't feel any issues. And then we put them through a process that is going to disrupt their lives, although temporarily. But for the rest of their life, they're affected by that diagnosis and that treatment process. And I've been a big believer that if, depending on how they get their diagnosis, depending how they go through their treatment, they could either be crumbled by this disease or empowered by this disease. So I wanted to be a part of that process and be at the beginning of when they first get their diagnosis and when they first go to their treatment to help them to be more in the empowered crowd. So my area of expertise within the breast surgical field would be cancer treatment specifically. Breast surgeons treat both benign and malignant diseases. I like all aspects of breast surgery, but my specialty would really be in breast cancer, in particular with treating young women who have been diagnosed early with this disease, as well as treating patients who are at high risk for this disease. My philosophy has always been the earlier you can get to this disease, the better chance you have at a cure. And so educating people and empowering them by that knowledge to be diagnosed early is one of the best ways we can treat breast cancer. The patient is actually a person and an individual, and that individual is not just about their disease, but is also about their other aspects, their culture, their beliefs, them as a person. And I believe in treating not just their disease, but also that patient as an individual. I think that if you can treat the person holistically and look at all aspects, you're actually doing better in terms of your treatment for their disease because you're addressing all their issues. I also believe that this disease is treated as a team, and with that team, I believe the patient is the captain of that team. And I think that it's a very important thing that breast specialists and all physicians should put in their repertoire, because once the patient feels that they're in charge of their treatment, they're more willing to kind of participate and add to that care and do the things that we'd like them to do. Luckily, breast surgery has been moving, and breast cancer has been moving more towards my philosophy, which is individualizing treatment. We've been finding, especially there's a process that we use to evaluate the genes in a tumor. We use Oncotype DX. And that basically looks at the genes that are in the tumor to kind of tailor what kind of therapy this person would need. So in the past, what we used to do is just everybody got kind of the same sort of treatment depending on a few factors. Now we look at more specific factors, particularly about the tumor, to determine whether they need a specific chemotherapy, do they need radiation, or do they need a specific type of surgery. And I think that in particular with the chemotherapy side of things, that tailoring who really needs the chemotherapy and who does not by using this Oncotype DX is very helpful. Any patient that gets diagnosed should be seen within 24, 48 hours. Not because the disease is aggressive and it's going to change, but I don't want them to get too much information that's going to send them on a track that they really don't want to be on. So I think the quicker they can get into our practice and to see somebody who can sit down with them and explain, you know, you're going to be fine, we're going to need to do these things to get you there, but you are going to be fine, is important. And that we're a team, and that we don't just look at them for their disease, but we look at them as a person, and that we want to treat them, even if their issue is not necessarily cancer, if they have some other issue, we also help try to get them resolve that. Because again, it comes down to that person. And you can treat the disease, but if the person is not where they need to be, you really haven't done much. One that does stand out is where I was in my previous practice. There's an award that's given to young physicians. It's called the Megiddo Award. And it's many different hospitals in the county and many different physicians, over 200 physicians are put up for that. And this award is awarded to a physician who not only shows excellence in patient care, but also shows a special sensitivity to the patient-physician relationship. And I think in order to get that award, what has to happen is your colleagues write a letter, but more importantly, your patients write letters. And I had the opportunity to read some of those letters and found that I actually was doing what I set out to do, which was to encourage that patient-physician relationship and to enhance our relationship as a family and a team. And it wasn't just me being the doctor and them being the patient, but it was two people working together to get the best result. I chose Maimonides for many different reasons. One, because it's a great city of Brooklyn. I really do like this town. As I said, I went to high school here. I think there's a lot of diversity, a lot of opportunity. I think Brooklyn is undergoing a renaissance, and I want to be at that renaissance. I also chose Maimonides specifically because I think it's a great team. Our breast team is filled with individuals who could have gone anywhere and chose to come here because of the excellence that Maimonides offers as a hospital in general.